Tonight's event is entitled The Implications of Overturning Roe versus Wade. PHE is an organization, as some of you know, who in part ensures that young people can access resources and information about their sexual health, which of course connects directly with the conversations about reproductive health, reproductive rights, and reproductive justice. When our team was working with the panelist team to design this conversation, and Sasha and I, again, who's our development manager, were processing the conversation, so much of our reflection was around how we felt really grateful for the information that we were taking in and that we had been gifted by these four wonderful experts and individuals. However, also some somber feelings about recognizing that there's a lot of work to do in this domain. So the conversation will sit in both of those spaces, and I want you to be prepared for that. Naturally, our conversation centers on Roe versus Wade in response to the ongoing chatter in the socio-political sphere regarding that topic. We're going to go through three phases of the conversation. Number one, it's important that everybody's working with the same information as often as possible. So we're going to make sure that you get some background about Roe versus Wade, what the implications of it are, of course, as stated in our title, what the impetus of it was, etc. We're then going to move into a conversation about what the future looks like. After that, we will end by talking about what you can do following having received this information and been a part of this dialogue. As promised, I'm going to stop talking very soon and pass the mic. I want to make sure that you all meet these four wonderful, dynamic, esteemed people who have chosen to be on our panel. We're very, very grateful. Again, they know themselves best. And so team, what I'm going to ask you all to do is share who you are, whatever that means for you, how your professional work intersects with the topic that we're discussing today. And then lastly, just for fun, tell us one thing about yourselves that you want us to know. It could be about your work, it could be about your kid, it could be about whatever you want it to be about, again, in service of making sure that we are creating community everywhere we go. We're gonna start with Kirby, then go to Dr. Tyler, go to then Dr. Rubino, and then also to round us out, Ellen. If you would like to be called by this panel, by this community by a different name than the one I just addressed you by, please let us know and I will honor that for the rest of the time. Thank you. Kirby, can I pass to you?
Of course, thank you so much. Hi everyone, my name is Kirby. My pronouns are she, her. I'm a staff attorney at the Center for Reproductive Rights. The Center for Reproductive Rights is a nonprofit that works around the world to protect and expand access to reproductive rights. I work in the US litigation department, which what we generally do is we sue states when they pass abortion restrictions and abortion bans. Right now I'm litigating cases in Georgia, Oklahoma, and Kansas. I found my way to this work through kind of a circuitous path. I was working in global health before law school, and then in law school became very involved in working with women experiencing domestic violence and with recent immigrants to this country, and kind of saw all the ways that inequity appears in our country, not just in the global world, and have kind of gone from there. So I will leave it at that, and really looking forward to being in conversation with you all this evening.
Hello, everyone. Can y'all hear me okay? Okay, great. So my name is Crystal Tyler. I use she, her pronouns. Crystal is actually fine in this space. We're all close. We're getting to know each other. We're friends. It is very nice to see you all on this panel. I am the executive director of CI3 at the University of Chicago. We're a research center that focuses on adolescent sexual and reproductive health. I have worked in the reproductive health space, I think, for my entire career. And before that, I went to an all-girls, historically Black college, so was intimately involved in reproductive health, reproductive rights, reproductive justice. This is just ingrained in who I am as a public health professional. I'm a researcher by training, but I like to think of myself as someone bridging the gap between science and justice. So I'm really excited to be here and can't wait to have this conversation.
Hey everyone, this is Dr. Rubino. Sorry about my video. I'm going to keep it off because somehow it seems to operate better if I do it that way. So I am a family medicine physician. I graduated residency in 2016, and since then at first I was a general family medicine practitioner doing abortions part-time, and then I transitioned into full-time abortion care, which is what I do now. And then in addition to that, I'm a telemedicine provider with NARAL, and yeah, that's all online. We're doing birth control, HIV prevention medications, among other things. I got into all of this work really once I was already in residency. I knew I was going to be doing women's health, but then my definition of that really started to expand, and I realized that I found out that there were not very many abortion providers in the state of Texas, which is where I was training. And so I figured that I better do something about it. And so that's why I've been doing what I've been doing for the last couple of years. Thanks so much.
Hi, I am Ellen. My pronouns are she, her. I'm the chair of the Orange County Action Council with NARAL Pro-Choice America. So I'm a volunteer there, and I work in an established group of volunteers who work to engage Orange County residents in the fight for and to protect reproductive rights. You know, I began this work because of my deep-rooted passion for fighting for the rights of all women, and I really just wanted to find a meaningful way to be involved, and I've been able to do that through NARAL. Another thing to know about me is that I'm also a mental health worker who works with adolescent mental health treatment.
Thank you so much, team. Sasha, you want to introduce yourself as the person who is making all the things happen behind the scenes so people know who you are?
Yes, thanks, Rachel. My name is Sasha Rosemont. I'm the development manager here at Peer Health Exchange Bay Area, and I have worked with the Next Council, who is our group of young professionals that are working really hard to bring these urgent conversations to our wider community. They are on here. If y'all can wave, that would be great. And happy you all are here, and so excited for this conversation. Thank you.
Thank you. Team, I didn't lie. This is an amazing group of people who have gathered to speak with us today. I feel very fortunate. I hope you feel the same. Let's jump in. The first question, and again, we're starting with background, so this question will be first for you, Kirby, and then next for you, Crystal, but same question. Language is so important generally, but especially in the context of social justice. Often we hear folks use the terms reproductive justice and reproductive rights interchangeably, and actually you two corrected Sasha and I and made sure that we were on the right path in thinking about this, so we appreciate you for this. What do you understand the difference between the two to be, and why is noting that difference critical? Kirby, I'd love for you to give an overview of the three: reproductive health, rights, justice, and Crystal, I'd love to ask you to round out the conversation by really focusing on the definition around reproductive justice and what that means for individuals. Or what that
Sure.
means, excuse me. Go ahead, Kirby.
Oh, sure. So let me start with reproductive health, because that is the one that I should leave for Dr. Rubino, because that really refers to the health service, that reproductive health services that a provider provides to people who have uteruses or people who need reproductive care. Reproductive rights refers to legal rights. So when I'm going to talk later about legal cases, those are about you know, the right to make decisions about your own body, and those are the legal protections that we have, in this case, in this country. Reproductive justice is a more recent term, and it was actually coined in the 90s by a group of Black women who recognized that reproductive rights did not apply to everyone equally. And so we can talk all day about reproductive rights, but if there's no access, then that is meaningless. So the term reproductive justice refers to the ability to have a child, to not have a child, and to raise a child in a safe world in the way that you want to. So that obviously intersects with so many other social justice issues. And so reproductive justice has really become a growing movement over the last few decades as people have really recognized that rights are not enough, and we need to think about our entire lives and the context that we're all living in. So I'll leave it there and I'll pass it off to Crystal.
Thanks so much. So I will say, I totally agree. You hit the nail on the head when it comes to reproductive justice. The things that I'll add, I'll just add a couple things to that. One is I want to specifically call out Sister Song as a group of women or individuals of color who really did a lot of work around this movement. And if you're interested in more about reproductive justice and the actual movement, I would definitely say check out their work. I also want to focus on the rights portion of reproductive justice. Reproductive justice isn't just about women's rights or individuals with a uterus. It's really a human right. It's based on the United Nations definitions of human rights. So I really want to focus in on that. It's not just women or individuals who have a uterus who should be concerned about that. The second thing I'll say is it's not just about, it's about access, and it's not just about choice. So when we think about reproductive justice and the decision to have a child or not have a child, to the timing around when you want to have a child, parenting a child, the way you want to parent that child, all of those things are about access to the things that you need in order to be able to do that. And again, I'll say this again all day, it's not just about abortion, it's about all of those decisions and that bodily autonomy, and these are human rights that we're talking about when we say reproductive justice.
Excuse me for being a little bit late on the mute button. As I said, I'm learning, so I'm taking notes, and I'm a student here as well, but I have to also be focused on being moderator. Thank you to you both. Next question is for Dr. Rubino, and then also for Ellen as well. Ellen, I'm going to have you answer first, actually. What do you understand to be the key barriers to accessing preventative reproductive support and care? So Ellen, please first, and then Dr. Rubino.
I think that in California, we feel we're very protective and progressive in this way, but there are still a lot of issues that women in California even face when it comes to abortion access. Kind of like Crystal was saying, like it's one thing to have that choice and have the right to do it, and it's another to actually have access to be able to do it. There's like a study in 2017 that showed that 40% of California's counties had no clinics that provided abortions. So I think it's really important to consider things like that, and consider not only does abortion need to be legal, but it needs to be accessible to everybody based on location. And like one example of something we did with NARAL was in 2019, we helped pass SB 24, which expanded abortion care at California public universities by requiring UC and CSUs to offer the abortion pill at campus health centers. So again, increasing access to different demographics such as college students. And working with college students in California universities is something we're still doing a lot of work with to make sure that college students do get the access that they need.
So to add on to that, when it comes to talking about barriers, also talking about location, it's a very large, I'm practicing here in Texas, a very large percentage of our state has absolutely no access to, it was certainly not abortion care, but then there's even many patients who come and see me who drive from hours away who tell me that they don't have contraceptive care. And that's a large reason why I decided to start working with NEREX and doing telemedicine, because obviously now that we're moving into this realm of being able to do a lot of things via telemedicine, we're able to offer those contraceptive services. I mean, we're still at a place where obviously not everyone knows about it, and I'm still getting patients in the clinic to this day who not uncommonly will tell me they were not able to get their birth control because their physician was opposed to it. And so, you know, we're at a place still in the state of Texas where we do not have full bodily autonomy. I recently had a patient who came to me and told me that she had been refused a tubal ligation. So again, we still don't have bodily autonomy, and a lot of it depends on where you live, and you know, it's just a byproduct of where you happen to be.
Thank you so much to you both. Crystal, I see you unmuting, and I realized, no, you're right. I'm wrong. I know that you wanted to say a couple words about the reality of women needing different things at different times in life, and I'd love to ask you to say a couple sentences about that. Thank you.
Sure, and I also just wanted to jump on to the last thing that was stated about access to tubal ligations to say that, you know, depending on where you are, we know that there are entire states that may have one clinic where you can receive the type of care that you need to receive. But what individuals don't realize is that where you go to receive your care can determine the type of care that's available to you. And one example is around religious healthcare institutions. So I don't think that a lot of people realize that if you go to a religious healthcare institution, you will not have access to just basic reproductive health care. And they're not required to tell you that they don't provide basic reproductive health care. So going back to your question around barriers to accessing care, just knowledge that the place that you would go to receive your care may not offer you the full package of reproductive health care. So that's one thing I wanted to touch on. The other thing that I think is really important in terms of barriers to accessing reproductive support and care is that we as, now I'm thinking about myself as a provider, a public health provider, we don't often think about reproductive health care in the same way that women think of reproductive health care. They don't think about themselves at just kind of static points in time as someone who's, okay, now I'm 22, I need contraception, I need to go to this place. Okay, now I'm 45 and I got pregnant and I don't want to keep this baby, now I need to go to this place. They think about themselves as just an individual, and they think that they should be able to receive whatever care they need from whoever they should be able to receive it from. So I think a broader barrier is that we're not thinking about the individuals that we're serving in the way that they are thinking about themselves and their bodies and their lives. And I think we could do a better job of really linking everything together to make sure that they can get access to whatever care they need at whatever point in time easily.
Thank you, Crystal, for making sure we didn't miss those pieces. Kirby, I'm coming to you. I think you know. This question just centers around the fact that, you know, we, as we talked about in our planning session, want to make sure that we're always talking through things with accurate information so that we can avoid misconception. I'd love to ask you to speak to the following things. One, what was the impetus for the court case Roe versus Wade? One. Two, what protections does this allow for? And then number three, you know, again, as I shared, Sasha and I were blown away by all the things that we were learning in our preparation session with this panel. Can you just make sure that we understand some of the lesser known legislation related to Roe versus Wade or in the same vein that folks should also be aware of?
Sure. So I'm going to do my best to cover some pretty complicated litigation over the last 50 years, and I'm going to try to do it briefly. So please let me know if anything I say is confusing. So I think most of us have heard about Roe versus Wade. It's a pretty seminal case. In 1973, the US Supreme Court found that the states could not ban abortion. So abortion became legal before the point of viability, which means before a fetus can live outside the body with or without assistance. So this was obviously a huge moment that suddenly this care that had been illegal, that had been harder to access, suddenly becomes, well, not accessible for everyone, but more accessible for people in this country. So even now, I think when we hear about reproductive rights, we think that kind of Roe is the last time we've talked about that, but there's actually been a lot of litigation since that time that has kind of redefined exactly what our rights are under the Constitution based on kind of litigation since. So we still have Roe. Roe is still good law. And so when states try to pass bans on abortion, like they did in 2019, so a number of states tried to ban abortion at different points in pregnancy that were all pre-viability, those laws are all unconstitutional under Roe. However, people have gotten trickier, and they have not just passed abortion bans, they also have passed hundreds of abortion restrictions. So these are not outright bans, but these are laws that make it harder to access abortion. So things like you have to take 2 trips to the clinic, and then you have to wait 24 hours between the visits. Or an abortion clinic has to have hallways of a certain size, or it has to have water fountains in a certain place. Or physicians that work at the clinic have to have admitting privileges to a local hospital. So a lot of these restrictions seem like they might be connected to health and safety, but when you really drill down into it, they're not, and they're really passed just in order to make abortion harder to access. So the laws that we talk about now are a litigation from 1992 called Planned Parenthood v. Casey. So this is when we really redefined how we evaluate abortion restrictions. And so what that court found is that, and this, the ruling from Casey has been reaffirmed twice since then, once in 2016 and once just in June by our Supreme Court in a case called June Medical. What the court found is when you have an abortion restriction, you have to do something that's called the undue burden test. You have to do a balancing test. So you look at the law and you say, okay, what are all the benefits of the law? So the state may say, this restriction will help women's safety, it will make abortion safer. And you say, okay, those are the benefits. And then you look at the burdens. And so you look at, it's so much harder for people to access abortion. Abortions are delayed, they're later in pregnancy. And so, there's all these things that go along with that. And what the court is supposed to do is do a balancing test. And if the burdens of the law outweigh the benefits, then the law is unconstitutional. So that's the framework we're operating under now. I would say that is the law of the land. It's applied differently in different courts, and that's what we are constantly fighting in our litigation, is to have courts fairly apply that framework. And so I think a really good example is, as you mentioned, kind of some of the restrictions that come up. So when we talk about access, so, everyone in this country has the right to have an abortion, but if you are a low-income woman living in Louisiana, there are now 3 abortion clinics in the entire state of Louisiana. And Louisiana has a 2-trip law and a 24-hour waiting period. So you have to figure out a way within the weeks that Louisiana allows you to get an abortion, because they've also limited that, even though they don't go all the way to viability, even though that's unconstitutional. So you have to figure out a way to get yourself to drive several hours to an abortion clinic, meet with someone who gives you information that you didn't really need, and you certainly didn't need to get 24 hours in advance. Then you either need to drive all the way home, or you have to pay for a hotel that night. You have to wait 24 hours to think about your decision, even though you've probably spent weeks figuring out how to make this all work and you've thought a lot about it. And then you have to go back for your second appointment. So in doing all of that, you have missed days of work, you've had to arrange for childcare, you've had to arrange for transportation, you've had to potentially arrange for lodging. It's incredibly expensive. Louisiana does not allow Medicaid to cover abortions, so you're also figuring out a way to pay for all of this. And, under Casey, that is all constitutional, because they have found that those burdens do not outweigh the benefits of the law. So it's really an uphill battle for us as we're litigating against some of these laws. So that was a lot. I'll stop there.
We appreciate you for making sure that we have a complex understanding. One thing that I just want to say, I felt my face changing as you were talking about this, and this is the second time that I've heard you speak on this topic. And, I think I want to give you special appreciation for making sure that as you presented a challenge, you also put that in the context of a real lived experience, right? I think oftentimes when we're talking about things that are evidence of social injustice, in this case, evidence of reproductive injustice, if we don't think about that in the context of someone's true lived experience, we may miss the weight and the gravity of it. So thank you for that, Kirby. Crystal, I'm coming to you next. I'd love to ask you to speak on maybe just for, a couple sentences, and then we're going to move to the conversation about what the future looks like. How do the restrictions that Kirby talked about affect young people from your perspective?
So I'd say that Kirby really highlighted what the challenges are, and those same challenges apply to young people, except in a number of cases, they don't have access to the same resources in order to overcome those challenges as adults do. I'll also say that in a number of states, there are laws in the books that say that clinicians have to notify the parent or guardian that that young person wants to get an abortion, and then they need to wait 48 hours in order to actually provide that service. Although you don't have to notify a parent or guardian if a young person wants to parent a child or put a child up for adoption or any of those things. And although parents and guardians don't need to be notified if a young person needs to receive any other reproductive services. This is specific to abortion. I think the reason the law is on the books is because they say parents should be able to support their young person in their decision making. But what we found, research shows that the vast majority of young people speak with their parent or guardian about the decision to get an abortion if they decide to get one. And if a young person doesn't speak with a parent, it's because they have concerns, safety concerns, or they feel like they may lose their parental support if they find out. That's my kids in the background. So I'll stop talking now.
You know, Crystal, I actually think it was very well timed because at PHE, we talk so much about youth using their voices and exercising agency. And so I respect it. I respect it as exactly that. As we move to the conversation about what the future looks like, I'm coming to you, Dr. Rubino, for this question. As a provider in a politically conservative state, do you see a critical difference in the encouragement of or resistance to your work in Texas by comparison to more politically liberal states such as California?
Yes, and to some extent, I mean, I only have practiced really in Texas since graduating residency, although I did do a year of residency in Chicago. But I can tell you that just from conversations I've had with other providers that we're treated differently by almost everyone within the healthcare system, from pharmacists who will call me to ask about certain medications that I've prescribed a patient. Am I aware that this could be used for miscarriage management? Yeah, that's why I prescribed it. You know, people actually, the pharmacist giving my patients a hard time at the pharmacy, asking them if they are aware what it's used for. Also, I've noticed that I'm treated differently by even people at hospitals. It's very rare that I have to transfer someone to the hospital for care after an abortion procedure. But when I do, I specifically try to get them to go to a certain hospital because I know that that hospital knows me and they're going to treat me well over the phone. I'm not going to have to deal with that as a barrier just as a provider. And I have just a lot of my patients are just, you know, they still think that abortions are illegal, even though they are not and have not been. And I still, on the weekends, we still have protesters at our clinic. So we still have people who think that that's, you know, an appropriate thing to do, stand outside of a healthcare facility and voice their opinion, yelling at my patients. We have someone who stands out there with wearing a GoPro. So it makes it very, I mean, these are vulnerable. That's a very vulnerable feeling. You know, you're just kind of out in the open. That these are a lot of the things that we deal with.
Thank you so much for illuminating that lived experience on the part of you and on the part of your patients. This next question, team, I'm going to ask, panelist team, was intended for a response from all of us. We don't have to duke it out, but I would love for just two of you to respond to this question. Given that we're running a little bit short on time, we're just fine, but we're running a little bit short. Would love for two of you to answer this following question. Which elements of your everyday work change if Roe versus Wade is overturned?
Everybody's so gracious now that you said only two people can talk.
I know it.
I'm giving up the floor. Please, someone else answer the question.
I would love to hear. I'm muted. Sorry. Go ahead, Sasha.
Oh no, I thought someone else was talking.
Oh, just me, as usual. I think I'm going to ask Kirby and Ellen to respond to this, if you all don't mind.
Sure. I mean, I think for me, the biggest thing is community organizing. You know, it needs to be bigger. It needs to get more people engaged. It's really important that we continue to raise awareness about the issues and mobilize all over the country. And I think with the pandemic, you know, it's been really hard to learn how to do that virtually. But I think that in a way that gives us an opportunity to be able to help in places that maybe we wouldn't even thought we could before. So I think kind of putting ourselves out there to make sure we're doing everything we can to support this right all over the country.
I will just say, so I think the goal is that the Supreme Court will not overturn 50 years of precedent. Hopefully we will still have Roe as good law. And that's what we, you know, are working on, though we're also planning for if that is not the case. And I think one of the big things that we think about is work on the state level. So some states have passed something called trigger bans, which means as soon as if Roe is overturned, abortion immediately becomes illegal in their state. So that's not great. But then some states have affirmatively passed laws to protect abortion access, even if Roe is overturned. And you know, for example, last year, Kansas, the Supreme Court of Kansas, a state that we don't think is as particularly progressive, the Supreme Court found that abortion was a fundamental right under the Kansas Constitution, and it is protected as a fundamental right, which is incredible. And so I think it's really important for us to remember that though abortion can seem like a divisive issue, 7 out of 10 people in America think that abortion should be accessible and legal, and that Roe should remain good law. So again, I hope that Roe is not overturned, but I think that there's a lot of really wonderful work going on at the state level to protect those rights, even if that were to happen.
Thank you to you both. Community, also, I want to remind you, we're coming up on the time soon where we're going to be taking questions from you all. And so please remember to send us questions in the chat if you have any for our esteemed panel. Next question is coming to Kirby and Crystal again. I want to make sure we talk specifically about women of color for just a moment. We should always take that moment when we're having conversations about equity, so thank you for that. I want to also issue a disclaimer that this is a group that's not a monolith, and we have to keep that in mind as well. From where you sit, how does reproductive injustice disproportionately impact various communities of color?
I feel like I've been talking a lot. Crystal, do you want to start us off?
Sure. So, I mean, I'll say a number of factors that contribute to the need or desire to get an abortion, they disproportionately affect women of color. And this is the case for really any health outcome. We see this in heart disease, we see this in stroke, we see this in cancer, we see this in diabetes. We see this for pretty much any outcome that has social factors that contribute to it. So I think it affects this particular group of individuals more than it would affect the general population in the same way that it does for other health outcomes. I would link this back to the reproductive justice framework to say that, when we think about reproductive justice and think about it from the perspective of, the ability to have a child or not have a child, to parent that child the way you want, the timing of when to have a child. If you think about all of these things that would determine whether or not someone wants to get an abortion, a number of those factors, like, am I able to parent this child the way that I'd want to parent a child? If I have issues with access to medical care or transportation or housing or food, I may not feel like I'm in the best position to parent a child in the way that that child should be parented. And so when we think about women of color, individuals of color, we really have to think about all of these. We talk about it as interlocking systems of oppression, which is a whole bunch of really big words, but really saying that these factors don't just happen in a silo. They interlock and they interact, and they happen to the same person in a number of different ways. We also see this when it comes to our queer peers. A trans person who happens to be a person of color, who happens to have, all of these things really overlap, and it creates some pretty difficult situations for those individuals when it comes to their reproductive health and rights.
Yeah, I completely agree with all of that. I don't have much to add. I think the one thing I would say is, in our country, 1 in 4, almost 1 in 3, or kind of between the two, women have had an abortion. So there is no typical abortion patient. People people you love have had an abortion, but it's those vulnerable communities, women of color, Black women, rural women, poor women, whose access is just completely different. And they're dealing with all of these systems of oppression. And they're also dealing with, as Crystal spoke about, kind of inequity in the medical profession and the way that they are spoken to by medical professionals. And, we know that maternal mortality is 3 to 4 times higher for women of color. And that is, both kind of based on their demographics, but also based on the way that providers treat them and believe them. And I think that really speaks to what abortion patients experience, but just on a heightened level, this sense of not trusting decisions that they make and not believing that they understand themselves and their bodies best, and that they should be trusted to make decisions about themselves. So it all just compounds, as Crystal said.
It all just compounds, I think, is a takeaway that we can hold as walking away from this conversation for sure. We're at our last question, which is hard to believe. The time has gone by so quickly. And I'm thankful again to this panel for the wisdom that you're sharing with us. As we spoke about, as we said we would, we talked about the background of Roe versus Wade, what are all the things that surround that. We then went into a conversation about what does the future look like, speculating about what could happen and what the response is should that happen. We're now at the place rounding out where we're talking about what you can do. This is a question for all panelists. I'm going to start with Ellen, go to Kirby, then to Dr. Rubino, and end with you, Crystal. It can be really easy in moments of socio-political upheaval to feel overwhelmed. We all know that feeling. We all have experienced that in some capacity. If there was one, or if there is one actionable thing that we can do today following this conversation, what would you ask for it to be?
I would say signing up for an event, you know, getting involved in your area. I know for myself, like that really overwhelmed and out of control feeling has really been able to be channeled into the work that I do in my community. So I would encourage people to do that. You know, NARAL has groups all over California that do a lot. And like I said, there's also virtual events that you can attend all over the country. So I would really encourage people to use the time that they have and the resources and the privileges that they have to be able to help others. And I'll put the Instagram for NARAL California in the chat in case anybody wants to go look at what kind of events are in their area.
Great. I would say really talking to the people in your life about abortion and talking about it as a basic form of healthcare. I think it tends to become this kind of thing on the side. There's healthcare and then there's abortion. And abortion is a central part of healthcare. And it's a healthcare service that, you know, so many people access, but we are embarrassed to talk about it. And then I want to put in a small plug that, again, abortion is expensive. Several $100s at the least expensive, thousands of dollars at the most expensive, and most states do not cover it via Medicare. So I would also see if there's an abortion fund that you can contribute to, especially in a state where access is really restricted, which happens to be mostly in the South and the Midwest. I think those are two really concrete things that you can do.
And I'm going to say that I have really two things, and sort of on a practical note. So if you're someone for whom an unintended pregnancy is a possibility, I tell people to go ahead and try to think ahead, unlike how we normally would, and try to shore up like having access to Plan B emergency contraception, make plans for how you're going to access your contraception if you're not able to do it locally. You know, utilize telemedicine companies like NARAL that can get you your birth control. I also would say that if you are in a place of privilege or you feel comfortable doing it, I would ask your healthcare provider if they are someone who believes in your bodily autonomy. I think we should get to a place where it's really I mean, I can't believe that I'm saying this now, but it should be expected of physicians, and you know, we should expect that from them and should be able to essentially find a physician. You know, not all of us have that privilege, but if we do, you know, we should exercise it.
I agree with everything that my counterparts have stated. The only things I'll add are two things. One is really normalizing this, and it's kind of building on what Kirby mentioned, but to say that 1 in 4 will have an abortion in their lifetime, that's very, very common. You know someone who's had one, whether or not you know it, that you know someone who's had one, or you know someone who will have one, or you will have one. I think it's important that people realize that it's not just those people over there who need it, or those disadvantaged, those people of color. It's not them, it's really us. And the quicker we normalize this is something that people will need access to it over the course of their lifetime, the better.
Thank you so much. I'm exiting this conversation, not quite yet, but exiting this part of the conversation with Crystal, those words in my mind. It's not them, it's us. I think there's so many things that fall under the umbrella of inequity that can be where conversations can begin from that exact place. And so I ask also this community to hold that as well. Again, to our panel team, thank you so much for all the wisdom that you shared with us. We're so deeply appreciative. This is now the time where the community gather can ask some questions. Thank you, Heather, for that feedback. I'm so glad that you feel that way. Do we have any questions, Sasha, in the chat?
Yes, a few.
Great.
You want me to just go for it?
Please, thank you.
Okay, Kirby, I think this one is for you, but I think everyone else can chime in if they have something to add. But what do you, hold on, I'm trying to read it and parse it out. Are you concerned with the composition of the Supreme Court given Amy Coney Barrett's recent confirmation? And I'll add to that, because you have talked about precedent that has been over a span of 50 years. And so those two things in relation to each other, you know, what does that mean?
Yes, I think we know pretty clearly where Justice Barrett stands on this issue, and can kind of suppose that she will not be a friend to abortion access or abortion rights. I think that, I mean, I guess two things that are kind of coming to mind for me. I think the first is what I said earlier about really shoring up access at the state level. And there's so much work that can be done in state courts. And I think that's really important to keep in mind, that, you know, Roe is a federal law, but there's also, every state has its own constitution, and there are a lot of protections that can be gained on the state level. And then it'll be interesting. I mean, I think it is probably likely that an abortion case will go up to the Supreme Court in the next few years. There are a number that are quite close right now. And it'll be interesting to see what happens. You know, Chief Justice Roberts in 2016 came out against the case that the center brought, which was Holman's Health. He would have upheld a law as constitutional that restricted abortion. But this time, in what year are we in, 2020, he joined with the majority. He wrote a concurrence, but he joined with the majority, saying, you know, I don't agree with this law, or I agree that this law is constitutional, but based on precedent, I'm going to go with the majority. And so it'll be really interesting what kind of comes of that, and where people's allegiances sort out. The Supreme Court is very complicated, and there's a lot of moving pieces, but I think there are reasons to have some hope. Not everything is lost just because we have a new justice on the court.
Okay, next question. Which states are on track to implement the most restrictions on reproductive rights? And I think, Ellen, you could speak to the second part of this question. As a non-resident, how can we get more involved and participate in advocacy efforts in different states?
Would you like me to cover the restrictions piece?
Yes, I'm sorry. You can do this part. Ellen would love for you to get the second part.
Okay. So we won't know until legislative sessions start. Generally, they start in January, and not all states are in session every year. For example, Texas took off this past year, so we had a little bit of a break from them. But it's the normal players: Louisiana, Mississippi, Texas, Oklahoma, Alabama, kind of the ones you would suspect. So unfortunately, so it will be interesting this year. Obviously, after an election, it'll be interesting how things shake out. Often leading up to an election, we expect a pretty bad session, because people running for office want to show that they're tough on abortion and kind of make a statement. This year, we luckily, well, not in a good way, but because of COVID, a lot of sessions ended early, so we didn't see the restrictions that we expected to see. But I have a feeling this will be quite an intense year. So I think that's certainly something to watch, and to really make your voices heard when you see, if you're in a state that's passing a restriction, like lobbying and going and showing up at your state capitol, those things really make a difference. And they really, you can get into the record and you can be on the record. And I think that's really a powerful thing for your representatives to see, that you don't agree with their positions.
Mm-hmm. Yeah, and I think in regards to supporting from out of state, I mean, one big thing, if people are able to, is definitely donating to groups who are fighting for that in those states. And also donating time could be an option depending on what's going on. Like I said, there's a lot more virtual events you can look out for by going to places like NARAL and looking at their website, always posting things like that. And then also, like, when it comes to like election time, there's lots of phone and text banking that can happen virtually. So there are ways to support other states if you're looking out for those opportunities.
Great. And I think our last question will tie us out. Rachel, how does this connect with PHE's work?
I was not expecting a question to come to me, and so here I go.
Yeah.
In so many ways, I mean, you all heard a couple different moments, community, you've heard a couple different moments at which folks on our panel spoke about the impact on young people. For me, and you know, this is how I see the work that PHE does. I think so much of the intersection has to do with the reality that we're talking about agency, we're talking about access, and the way in which as adults, that's challenging for us oftentimes because of all the things that have been shared by our panelists, lived experience, demographics, where you live, etc. All these things can become barriers to accessing things that are just your right, things that you should have. These are the same conversations that we have with young people. And I think that what makes me saddest, but also I think what makes me feel most motivated and committed to galvanizing others around this topic is the reality that as adults, we encounter this level of barrier and impasse. What does that then mean for the youngest folks in our society? If it's hard for us, it's especially hard for them. And so for me, the connection between what we've been speaking about and PHE is actually very narrow. There's not a lot of space between those, in my opinion. We're talking about the same things, except that I think our job as adults is to advocate for ourselves and also for the generation that's following us.
Thank you. I think that's all the questions. Unless anyone has any more, please drop them in the chat in the next 15 seconds. Otherwise, we won't keep everyone on this call and end our chat. Can we get everyone's Twitter, wow, I can't even, Twitter handle and information in the chat, please? Panelists, if you don't mind sharing your Twitter, why can't I?
I don't have a Twitter.
That's okay, LinkedIn works. I can send out LinkedIn as well, LinkedIn, Twitter, put them in the chat.
Oh, sorry, Sasha, please go ahead.
Just one more thing, any parting words from our panelists, anything we didn't cover that you'd like to say in this setting, please do. Reading all these chats, I'm sorry.
No, but it was a pleasure.
We appreciate you all so much. I see some things coming through. A couple other things that we'll tell you before we sign off. One, we're so appreciative. We take community really seriously at Pure Health Exchange. And it's always a joy and a pleasure to be able to have really serious, important conversations in community with other folks. I'm seeing faces of folks that I know, folks that I've never met, folks that I know are on the other side of the country or potentially in other spaces. And it's so powerful to have this moment where we're coming together speaking about a topic. I will also say that one of my takeaways from this conversation is that it is important that we take in information, but also that we move after that we act in some way, large or small, in response to what it is that we've learned. I think information is a gift, but we have to allow that information to motivate us, to galvanize us, to then do the next thing. I also want to make sure that I shout out this event, while I talked the entire time, was not my brainchild. This event was actually designed, devised, implemented by our next council. Many of those folks waved. Wave again if you are on screen so folks can see you and you can get your flowers today. They are a young adult board and they are responsible for this event. They push for this to happen. They, set the vision for it, and we're so excited that it's come to fruition, and we appreciate them, in particular their leadership, Lila Wolf, and also Sasha Rosemont, who you've heard from a couple times. If you are somebody who's interested in learning more about Next Council, please do respond to the follow-up communication that's going to be coming your way this week, saying thank you for attending this event, and we will make sure that you learn more about what Next Council does and the impact that they're trying to have on behalf of PHE. Lastly, we have another event this month at PHE Bay Area. We're very busy. We like to keep things moving. Clearly, we like to just be busy all the time. We have another event coming up on the 19th. On this event, we'll be talking about mental health, which is a key focus for Pure Health Exchange in this moment. We have Izzy Lopez of UCSF, who will be speaking to us about the toll that 2020 has taken on mental health. I feel like that's one that you don't want to miss. So if I were you, I would put it in your calendar. It's up to you, but if I were you, I would write it down. And then last thing, again, we just appreciate you. Again, we take community so seriously. We can't have this space without people saying yes to invitations to be in learning community with others. And so we can't tell you how much we appreciate you. Thank you for making the time. We hope you have a beautiful evening. Practice self-care. Make sure that you're taking care of your mental health. We send you our love from PHE. Thank you for being here.
Thank you so much, everyone. Have a good night.
Thanks. Bye.
Thank you.
Thank you so much.
Bye,
you.
everyone.